Okay, welcome again. You came from a long distance from another country.
Yes.
You came here for our special technique, Istanbul Varicocelectomy, that we remove the veins. How it happened? How did you find us? How your varicocele problem began?
So first of all, 2 years ago, I had the problem with varicocele, and I went to my country to a doctor, and we had the diagnosis varicose veins in both testicles.
Yeah.
So I had an operation, but it was
2 years before. Was it 2 years?
1 year before the operation. Yes.
Yeah.
So the operation was with microsurgery, but not like this technique.
Yes.
They didn't take out.
There is not such a technique.
Yeah,
it is what I
is,
find.
Yes,
so
yes.
With what's written in the literature is just do microscopic
microscopic ligation. Yes. So maybe I had pain gone for a month or two, but then everything came back. And
so you got pain previously, right?
Yes.
Testis pain.
Testis pain, and after the pain, I had some problems with libido.
Yeah.
And testosterone.
Erection quality.
Erection problem. Yes.
Yeah.
And then.
So you had this diagnosis. I know you tell me they hesitated at first to do or not to do because
they weren't sure. Yes.
Yeah. For pain in the literature, it is said there is only 50% chance of getting rid of the pain.
Yes.
Actually, because there is a 50% success, the 50% recurrence.
Yes.
So, and for erection, for libido, nothing is said in our literature about this.
Mm-hmm.
But with my experience, I see people have too much benefit from these. So, we are not specifically operating for sexual libido, such things, but many people are asking for it. Sometimes we do.
Yes.
So you had the operation. Then how many percentage you had benefit? What do you say?
From the first operation,
Yes.
the benefits were like maybe a month or two.
Yeah.
I had no pain at all, but much less pain.
Yeah.
But after 2 months, doctor, the pain came back.
100%?
100% and even worse than the first time.
Yeah.
So
maybe because they ligate,
yes,
the veins may become bigger.
Yes, that's exactly what happened, because after the operation, like after 2 and 3 months, I started seeing my testicles and the veins were even much more visible than the first time before the operation. And afterwards, like going on the internet and reading, I googled and I found you.
Yeah.
Found you, your name and your technique.
You understand the technique, right?
Yes, I understood the technique, and the first time when I saw what you explained with your technique, I felt that this is the one that I should get.
Yeah.
And
It's really seems to me very logical. There is a vein after procedure, 50% of the patients with a classical surgery, the vein is still there. It is not disappearing. So why not take it out? I talk this to vascular surgeons many times to what to do. I recognize this. Every urologist knows. We talk each other what you do after the surgery if the vein is still there. I say come 3 months later, come 6 months later, then the patient forgets. So this is not a good solution. Mm-hmm. And when I do specifically varicocele operation, a normal urology doctor operates 2 varicocele in a month. I operate 20, so I can't fight with 10 patients saying that okay, come 3 months later, come 6. So I talk to vascular surgeons, and one of my patients previously said to me, why don't you take it out? Why just like it? Why not? The patients always feel themselves the best way. The doctor don't understand.
That's
with
true.
5 minutes seeing him.
That's true.
But he lives with these veins, and he understands in the best way what's the problem, what should be done.
Should be done, yeah.
So, we've invented this technique. It is, the problem starts here, because when somebody sees this technique in the internet, they go to their urologist and ask, can you remove the veins? Do you remove the veins? Nobody is doing that.
Yes.
Because in the books, in the literature, in our education, we are taught just to ligate the veins, and we said they will disappear 50%, 80%. Well, you can't do more.
In the books they say so you can leave it to chance.
Yes.
But it's better to take them out. So
why nobody find it? Because there are many very serious diseases in the urology. Cancer, prostate cancer, kidney cancer. The good doctors are always dealing with this, fighting with this.
Yes.
By chance, I understand the mechanism of this disease, why it is not healing, why it is recurring, and I find it is by chance, maybe. But
by chance you found it, but doctor, you did a great job, because varicocele, maybe it's not life risking like cancer or something else, but varicocele, it destroys your quality of life,
and you are young, very young age.
If you're in a young age, it really has an effect on your lifestyle. Because a young boy, a young man, having problem, first of all having pain, and after that having problems with erections and libido, it's bad. It's bad.
We made a video talk with you before your planning your clinical. Your father was with you, and I can feel the anxiety with him.
Normal.
A young guy, his son. What is these problems? He is thinking, in our young ages we didn't have such things. Why this man is
why this is happening to
me? Is it psychological? Everybody thinks, is it psychological? It is not psychological. Everybody says, why do you always complain about your testes?
That's exactly what happened with me back in my country. Like I was going on and off to the urologist, going from one urologist to another, and most of the times they told me it's psychological. But how can it be psychological? I went back home, like 2 and 3 days, was thinking with myself, maybe he's right, maybe
you sent me a picture of the swollen vein.
And that you saw from even from the picture, you knew right away that that's a vein.
So we had the procedure like 3 days before. Can you feel there is some difference?
Yes, of course I can feel. First of all, from the day that I woke up from the anesthesia, I slept only one night on the hospital. I didn't have pain at all. Now is the 3rd day and I still haven't got any kind of pain, and I took a shower and I saw that there is completely no swollen veins on both of my testicles. They are all gone.
The good side of this operation, its results are immediate. Inside the operation, I take the vein out, throw it into wastebasket, and patient looks. Previously, when we ligate, the veins are still there.
That's what happened first time. After the operation, I woke up, and as I went home, I was so happy, and I wanted to see my testicles and see the veins. And I'm like, Dad, the veins are still here. But the doctor told us over there in my country that you should wait some 3 months or 6 months and they will disappear. But that's not what happened.
This doctor is 100% right. 100%. He has to do like this. The urology literature makes him do like this. Taught him, teach him, educated him like this. So I don't want you to go and blame doctors. Why didn't you take the vein out? It's only my technique. So I find this technique and call it Istanbul Varicocelectomy technique. And we need a scientific study to prove it, and so everybody will perform it. But it is impossible for me because when you come here, I would say to you, we have to do a randomized trial. That means you will come and choose one of the, make a selection. You will open it and you will see, oh, I will have classic operation. Just to make comparison, okay, I have to operate half of my patients in the classic way, half of my patients in my new technique. And people come to me for new technique. If I say, please make a choice, and if he selects the old technique, they will never accept. It's impossible in my practice.
Of course.
So a big university clinic, when they accept this, they will do it. But unfortunately, doctors are very conservative to change things if they are not found in United States. We always follow the United States methods, and one day they say, oh, 5 years before we changed the technique and we performed 100 cases in this new technique. We didn't do it. We do only what they tell us, but they change, they improve. We never. So I did it. I am happy with the procedure. The results are immediate, and you felt it. I'm very happy. Today, when I look with ultrasound again, there is no big veins that we see before the procedure. And we hope it will go on like this. still I have a 3% recurrence rate, but you are already recurred case.
Yes.
So in your case, I don't
It's,
wait any recurrence. And after the procedure, I do Doppler and make you strain. If there is a lot of reflux to little tiny 1 millimeter veins, I want really strict. I forbid the exercise, everything just to prevent recurrence. But your case is good.
Yes.
I hope it will not be so.
Thank
Are you
so
happy
much.
with our procedure?
I'm so happy with the procedure.
Thank
I'm
you.
so happy with meeting you, your
Yes.
professionalism,
Thank you.
and our stay at Istanbul.
Thank you very
Thank
much.
you so much, doctor.
Yeah, I really wish everyone not to have recurrence and
Of course.
and be healthy all their life, and for you too. Thank you for coming.
Thank you so much for everything.
Thank you.